And now, Mrs. Lindsay Lorman. You have 10 minutes.
What if I told you there existed an extract which could improve your IQ, that when taken would make you less likely to fall prey to infection or allergies? Regular intake would significantly lower your risk of being obese and cut your chances of getting leukemia or diabetes. It would even significantly lower your chances of dying in your sleep. More incredible still, the person delivering it would also benefit from a lowered risk of various cancers, cardiovascular disease, osteoporosis. Would you believe me if I said it was readily accessible 24 hours a day, produced in the exact quantity and temperature required? Administering a nutritional combination so perfect for the first 6 months of use, the consumer would need no other form of nourishment. No water, no supplements, no food of any kind. Not only that, this incredible blend is dynamic, constantly adapting at the cellular level to suit the needs of the individual. Life-saving and life-giving it is, without waste, plastic and packaging free, biodegradable and has no carbon footprint. Would you believe me if I told you this formula was openly available right now, absolutely and completely free? Imagine the effect it would have on the NHS if everyone used it. Research by UNICEF has suggested that if more people did, it could result in a yearly gain of around £17 million in the UK. And what about the economic effects? Some researchers estimate that if just 1% of those who don't administer the formula were to do so, we could see a small but significant national increase in average IQ. That could see a rise in economic productivity worth £278 million over the course of a human lifetime. Would you believe me if I told you that rather than being discharged from a syringe, it came in the form of a cuddle with your mum? Good morning. My name is Lindsay Lorman, mum to Patrick, who turned 1 this week, and I'm a service user of the Hampshire Breastfeeding Counselling drop-in service, set to close in 12 weeks unless sustainable funding is found. This unparalleled service was visited by 500 women in 2014. That's over 17% of all new breastfeeding mothers registered with local GPs. And yet, despite being outstandingly successful, with 98% of service users recommending the drop-ins, when the funding ends, they will close. Hampshire Breastfeeding Counselling are a not-for-profit organisation set up in June 2013 after being awarded funding from Hampshire County Council and Basingstoke-and-Deane and Test Valley Borough Councils. They manage 8 breastfeeding drop-in centres across North Hampshire, providing practical, evidence-based assistance from university-trained professional breastfeeding counsellors. So why is the service now at risk? Last year, the second grant for the drop-ins came to an end, so 100 women wrote to the head of public health petitioning for funding, with support from local councillors Elaine Still and Anna McNair-Scott and MP Maria Miller. Hampshire County Council offered an interim budget on the proviso that the public health team look at developing a sustainable model of support for breastfeeding women to be put in place from April this year. Yet the work remains incomplete, and with the drop-in service becoming increasingly time-poor, we are now facing a funding precipice. There are no reserves, no private backing, no volunteers able to make this service work. Unless I can convince you today of the social, financial and health benefits of the breastfeeding drop-ins, they will close. It fills me with dread to consider future mothers being deprived of this service, and it crushes me to think of all the babies who will go without if the drop-ins close. When I was breastfeeding my newborn son, I gritted my teeth, counting down the days until I would allow myself to give up at 6 weeks because I hated it. And yet here I am, a year later, still breastfeeding my son thanks to the skilled support of the breastfeeding counsellors. And here I stand pleading with you to find the resources to enable future mothers and their babies the chance to experience the same. The World Health Organization recommends exclusive breastfeeding for the first 6 months of life as the optimal way of breastfeeding infants. And in North Hampshire, 80% of new mothers start breastfeeding. 80%, that's pretty good. Yet 6 to 8 weeks later, only 38% of those babies are still being exclusively breastfed. In fact, by 8 weeks, less than half of mothers are giving any breast milk to their babies at all. Compare that to the women who use the drop-ins. At 6 weeks, 84% of their babies are still being exclusively breastfed. That's more than double. That's pretty incredible. So why is breastfeeding so important? My introduction may have been a little tongue-in-cheek, but it was also all true. The benefits of breastfeeding are astounding. It reduces the risk of children developing type 1 and 2 diabetes, or of being obese, and of breastfeeding mothers getting breast and ovarian cancer. It reduces a baby's chance of dying from sudden infant death syndrome. Breastfeeding quite literally saves lives, thousands of lives. And then there are the financial implications. In 2012, UNICEF commissioned a report in which they unequivocally conclude low breastfeeding rates lead to increased frequency of illness with significant cost to the NHS. Consider the fact that bottle-fed babies in their first year are 5 times more likely to be admitted to hospital with a gastrointestinal illness. Government data estimates the average overnight hospital stay costs £400, just a single trip to the GP, £45. By moderately increasing breastfeeding rates, we cut thousands of hospital admissions and GP consultations and save millions of pounds in treatment costs. Furthermore, the investment in effective breastfeeding services could provide a return within as little as 1 year. A friend recently asked me, if women have access to breastfeeding support through the NHS, why the need for the drop-ins? One struggling mum saw 15 health professionals before finding the drop-ins, and that's not unusual. In the first 6 weeks of Patrick's life, when I was struggling to breastfeed, I saw 5 midwives, 2 nurses, 2 GPs and 4 health visitors in 5 separate locations. And in between worries about breastfeeding my son, we also had to cover his weight, nappies, jaundice, heel prick tests, hearing tests, immunisations and my own postnatal recovery. Faced with a myriad of healthcare professionals in various locations covering a plethora of issues, is it any wonder 99% of UK women stop exclusively breastfeeding before the recommended 6 months? Problems with confidence, pain, supply, tongue-tie, mastitis can all see a woman's breastfeeding journey come to a premature end, but all these issues are being regularly addressed and resolved in the drop-ins. When my mother gave birth to me, she was in hospital for 2 weeks, during which time midwives taught her how to feed her baby. But with low-risk mothers now being discharged after as little as 6 hours, we're not afforded that luxury. And like many children of the 20th century, I was a bottle-fed baby. Generations of women in the UK today have never been exposed to breastfeeding, so the drop-ins provide the safe, calm environment needed to hone the skill and gain valuable support from other mothers. I want to remind you again of those breastfeeding statistics for North Hampshire. 38% of babies are being exclusively breastfed at 6 weeks. That figure rises to 84% for babies whose mothers visit the drop-ins. If they close, breastfeeding rates in North Hampshire will fall, of that be in no doubt. The exceptional support they provide is the perfect complement to the NHS, and they must be allowed to continue. 100 letters have been written to your Head of Public Health, pleading for funds so the drop-ins can continue. And here's where I reach the bottom line. Leaving all other factors aside, what is the price tag for this service? £40,000 a year. Roughly what it would cost to employ 1 midwife or 1 health visitor. A tiny fraction of the public health budget, but the value is immeasurable. As the Vice President of World Bank Global Practices, Keith Hansen, said just last year, in sheer, raw, bottom-line economic terms, breastfeeding may be the single best investment a country can make. Thank you.
I'd like to thank the Right Honourable Maria Miller for her deputation. In particular, obviously, I'd like to thank you, Mrs. Lawman, for your clear, concise, impassioned deputation. That does not take away the fact that Maria Miller was clear and precise. Okay. I'd like to welcome and say thank you for coming to all the support that you brought, including the young mothers and especially the young members of the county, who I have to say are a great example to our county councillors in terms of being well behaved. So thank you all very much indeed. You may stay if you wish.